Good day, dear friends. Glad to welcome you on Dr. Savkin's channel. Many of us wonder why our feet get cold. You have to wear 6 pairs of socks, regularly take hot foot baths, and wrap yourself in a blanket. And if you do achieve the desired effect, it doesn't last long. Why does this happen? Is it dangerous for life? And what to do with this? We will talk about this with you today. So, if your feet get cold in the cold season, it's normal. Don't get hung up on this. Feet are not protected by a fat layer. Blood acts as the only source of heat. In this case, the vessels constrict from the cold, and even the blood flow slows down while the feet freeze. In this situation, you need to move energetically, do a light foot massage, and your feet will warm up. And in case your feet are constantly cold, regardless of the season, you need to look for problems directly related to the vessels. Moreover, you cannot ignore this search in any case, because sooner or later, an unbearable end may come. So what exactly can happen to our vessels? With age, many people develop atherosclerotic processes in their arteries. In that case, if less than a third of the artery's lumen is closed, nothing much can be felt except for a sensation of cold in the legs. And in that case, if the vessel's lumen is half or more blocked, it becomes noticeable. First, we need to determine if the legs are actually cold. In other words, are our feelings subjective? Because often they can be purely subjective. If your feet are cold to the touch, you need to consider a circulation disorder. Next, we conduct an assessment of the condition of the skin coverings of the lower extremities. In doing so, we compare both legs. The sick leg may appear pale and feel cold to the touch, or it may have a burgundy or bluish tint. In some cases, you may notice small wounds or ulcers on it that heal very poorly. Due to the development of venous insufficiency and lymphatic flow disorders, swelling in the legs can be observed, the presence of which is easy to determine independently. To do this, you need to press on the skin of the lower third of the leg and watch for the formation of a dent, which does not disappear immediately when there is swelling, but after some time. Next, we try to feel the pulse on the foot artery, and then we compare the pulsation on both legs. Doing this is quite simple. Then we pay attention to the presence of pain during prolonged walking. In some cases, it is accompanied by a feeling of numbness and tingling in the legs. As soon as you stop, all the unpleasant sensations pass. Over the years, pain occurs with less stress and then even at rest. What arterial diseases should be considered first when such a clinical picture is present? In elderly people with such diseases as ischemic heart disease and hypertension, one can suspect obliterating atherosclerosis, which progresses rapidly with the presence of excess weight and low physical activity. But in young and middle-aged smokers with experience, obliterating endarteritis can be suspected first and foremost. Both diseases have similar symptoms. The principal difference lies only in the causes of the development of the pathological process. In the first case, it is atherosclerosis, and in the second case, the presence of an autoimmune process, during which thickening of the inner lining of the artery is noted, where over time mural thrombi form. Unfortunately, obliterating endarteritis is diagnosed too late. as they say when the train has already left. So what should we pay special attention to at the early stages of development and disease? First of all, pay attention to the curvature and flatness of the feet, hair loss on the legs, and the shape of the toenails. The darkening of the skin and the appearance of defects on the skin of the legs, which are difficult to treat, are characteristic of an advanced process. The success of treating obliterating endarteritis directly depends on the fulfillment of one very important condition. I mean a complete refusal to smoke. I emphasize this for your attention. And what else can happen with the vessels? Under certain conditions, from the effects of cold and constant stress, vessels can spasm. This phenomenon is most often observed in people with connective tissue diseases, such as rheumatoid arthritis, systemic scleroderma, dermatomyositis, Raynaud's syndrome and disease, and other processes. In Raynaud's syndrome, a three-stage sequential reaction can be observed. The fingers of the hands or feet first turn white, then blue, and after some time they turn red. The feet and hands are constantly cold during this. With this problem, unobtrusively, you need to seek help from a rheumatologist. Constantly cold feet can be a sign of chronic venous insufficiency. Women with a predisposition who are overweight have venous diseases such as thrombosis and thrombophlebitis and hormonal disorders most often face this problem. How to understand that the feet are cold due to the presence of chronic venous insufficiency? First of all, there is a feeling of heaviness in the legs, pain along the veins and swelling. In severe cases, hard-to-heal ulcers may appear. What should be done to thoroughly understand which vascular pathology we are dealing with? For this, it is necessary to conduct additional examination, namely ultrasound of the lower extremity vessels, rheovasography, capillaroscopy, and angiography. If deviations from the norm are detected, it is necessary to seek help from a vascular surgeon. The feeling of cold in the legs can also be purely subjective, which is noted when the peripheral nerves are damaged. Most often, people suffering from diabetes encounter this phenomenon. In this case, the perception of cold and heat is disrupted. Therefore, numbness of the legs, like pins and needles, becomes a constant companion in life for people with fluctuations in blood sugar levels. To not miss diabetes at an early stage of development, all you need to do is take a single test. I mean determining the level of glycated hemoglobin and comparing it with normal indicators. If this indicator exceeds the normal values, you need to seek help from an endocrinologist. People with low arterial pressure figures, hypotonics, may constantly have cold feet due to reduced blood flow, as well as people with arterial stenosis and insufficient arterial valve. With these problems, you need to seek help from a cardiologist. Thus, there are a whole range of reasons why feet can get cold. Doctors of various specialties can help to figure this out. But suspecting this or that reason is within the power of each of us. To find out what signs indicate clogged leg vessels, I recommend you watch this video. Stay healthy, dear friends, and until new meetings.